For decades, UPMC Hamot has led the way, foreseeing the challenges that lie ahead and making the necessary decisions and critical investments to remain a leader. But most importantly, to continue to bring the highest level of healthcare to the families of our region.
Well, clearly, I think everything that we predicted before the affiliation is becoming an increasing challenge. We are facing unprecedented payment cuts, payer mix changes, and reduced resources that we're able to deal with. So the affiliation with UPMC, and now that we're 2 years in, is a tremendous value.
We've now been entrenched in the last few years in declining reimbursements, restructuring for access, a focus on quality, a focus on incentives based on those qualities as well to make sure that you can maintain a high level of positive patient outcomes.
But make no doubt about it, payment cuts are going to continue. This is going to be the new normal. We have to become more efficient. We have to leverage the scale. We have to have standard systems that enable us to take that efficiency to the maximum. And again, as we said before, maximize those resources that go to patient care.
Every day we turn around, something new is happening from federally to locally, and we're really trying to adjust to make sure we're meeting the community's needs.
First and foremost, we look at patient safety and quality. That is our primary driver of what we do every day. Secondly, we invest a lot of time into staff development. Also, we've invested a great deal of effort into our capital acquisition through equipment, refurbishing our buildings. We have a $300 million investment provided by UPMC, and that really is our driver behind what we do every day to position UPMC Hamot into the future.
The basis for the integration with UPMC was always to keep people locally, create a Northwest tertiary hub for UPMC, and advance these specialties that were here. In the last year, we've seen an 8% increase in the patients who actually stayed local to advance their care here at Hamot. And so I'm pleased to say that I think the whole process has worked, and we're continuing to advance Hamot as a tertiary hub for UPMC in the northwestern Pennsylvania markets.
UPMC Hamot is growing its physician network by adding specialists to the area, in addition primary care, so that we have the access that is unprecedented to every level of care that you need, from preventative through emergent care.
Because of our ties to the University of Pittsburgh Medical Center, we have access to a lot of their practitioners, and we have some of their practitioners come here and spend a day or two a week and see patients here rather than having patients going down to Pittsburgh.
The ability for Hamot to bring specialists here, recruit specialists here to Hamot, make it attractive for physicians and those hospitals to refer patients here has obviously been our goal.
UPMC Hamot has advanced our breast imaging services beyond an unparalleled service prior. You can get results and follow-up studies, and then even a biopsy, all in the same day, at one of the most nerve-wracking times when you've received a report that there's something wrong. And those words stick in your head and you can't think of anything else. From beginning to end, that time of wait is as minimal as possible. You have all the answers and all the information that you need before you ever leave the door.
Transcatheter aortic valve replacement is replacing the aortic valve, which is the main valve that lets blood out of the heart, through the leg, or another approach is through a small hole in the chest, but presently we're doing it through the leg arteries. It's a really exciting technology because aortic stenosis, or narrowing of the aortic valve, is a very common problem, especially in the elderly, and many of these elderly patients are too high risk to undergo the conventional operation, i.e. open the chest and be on the heart-lung machine. This is a really an amazing procedure, and the awesome part of this procedure is it's a team approach, okay? And we have so much expertise in the room at one time, it's really benefits the patient tremendously.
We have been able to add a level of pediatric care here in the area through pediatric specialty clinics, currently located at the Shriners Hospital. Now we have a full-service complement of pediatric neurology, pediatric neurosurgery, pediatric GI, offered locally at a level of service that you could only previously leave town for. Many of those are chronic conditions that you would repeatedly make trips out of town, which hurt families, communities, children having to leave school repeatedly.
Robotic surgery is becoming much more popular and is being used across many specialties now. And the use of the Da Vinci robot has increased dramatically here. And we see, almost every day we see surgeons using the Da Vinci device to go ahead and do laparoscopic procedures with. All the new technology that we have available to patients allows a cutting-edge medicine to be practiced here at UPMC Hamot.
At a time in a person's life when they're needing to access transplant services, it's a very stressful time for the family, and it is a very difficult procedure to recover from as it is. And then now allowing us to do your follow-up care, your pre-procedural care here locally, and ensure that the highest level of quality and a seamless continuum is always provided.
Well, we've showed over the years that we've been a quality provider, and obviously our recognitions and the things that, the acknowledgments that we've had, not only from the external bodies, but also from the community, have been proven that Hamot has been there for patients when they've been needed. And I think that there's no question that the access to our services will continue to be important for patients in the community and the region as we continue to develop the high-level tertiary care services that the community needs and wants.
We will continue to be focused on quality, and that is our #1 job relative to delivering quality patient care. And we think if in fact your employer has Hamot in their insurance choices, that more people will choose Hamot based upon that quality reputation.